Hi, my name is Claudia McCoy. I'm an endurance athlete as well as endurance coach, personal trainer, and my background is in physical therapy in Germany. So sports always has been my passion, my job, everything I do. So since a kid, I've played team handball in Europe. Some rough sports, karate to tennis to every sport that you can think of. Always been active. Here in America, I moved here in 2002. I became an elite age group triathlete, and I'm now actually a triathlon coach as well as run coach. And it didn't just become a hobby for me; it's my life. Recently, in August 2024, I started having knee pain in my right knee. In 22, I had a meniscus surgery where they cut off just a little bit of my meniscus. My background is I have bow legs, so that's like always there. That's genetically there. But I never had problems there. As a teenager, they told me one day I will have problems with it. Well, now I'm 53. And so 2024, my knee pain started. I couldn't run anymore without pain. I started limping. I started feeling it during the day. It eliminated really a lot of my activities, or if I did them, I always did them with pain. And it became no fun. I was going to different doctors. I had a Baker's cyst. They constantly kept draining it every half a year. I was really kind of I tried PRP. I tried the gel injections. Nothing really helped. And yes, it wasn't too bad. I could still run, but like I said, always with pain. I wasn't competing anymore in triathlons. I kind of told myself I'm going to retire. And then I was scheduled to get a knee replacement because 3 of the orthopedic doctors I've seen said, that's the next thing for my bow legs and that I'm bone on bone, arthritis, that I need a knee replacement. I actually had it scheduled for a Thursday in December. I met a friend of mine, another triathlon coach, and he told me about Dr. Tamea, and he said, you got to see this guy. He's going to help you. So I contacted them right away. They took me in the next day, which was on the Tuesday before that appointment on Thursday with the other knee replacement specialist. I came in and he said, you will be the perfect candidate for the stem cell injection and the ozone treatment. I completely trusted him right away. I scheduled it with him. I canceled the knee replacement specialist and said, you know what, I'm going to give this a chance. This is before the next step, which is huge. So I did that. And, I'm always very skeptic. I'm like, okay, let me see how much can it really help? Like everything else never helped yet. So every week I feel I can do something more. And today was a breakthrough. It's been 8 weeks. On Thursday, I ran for the first time outside without pain. I can actually feel my normal stride coming back, which I really, of course, compensated a lot for lately. My stride came back. I was able to run 5 miles without pain. Usually it would start setting in at mile 3. So that was great. And then today, for the first time, since August 2022, I could not do like a one-legged knee bend or stand on one leg to take my socks off or anything like that because of pain. Today I was able to do a one-legged squat repetitively without cruciating pain. So that was a big breakthrough, and I'm very, very hopeful that I might compete again. I don't know. That's one of those things where I don't know if I want to, but I could. And I really want to thank Dr. Tamea for that and for trusting me and being the right candidate for his treatment. And I gotta say, I'm very wowed so far, and I can only recommend him. Thanks.